Hello and welcome to my capstone reflection video recording for NURS FPX 4900 intervention presentation and capstone video reflection. Introduction. The opportunity to apply evidence-based practice to patient outcomes and quality of care for managing patients with chronic condition was part of the capstone project in hypertension. This project sought to close the loop on the management of hypertension by using healthcare technology to facilitate regular blood pressure monitoring and providing personalized intervention to address the clinical and psychosocial sides of hypertension management. The intervention involved engaging the patient, her family, and the healthcare team and promoting active participation in an empowerment to control health. This reflective assessment also points out patient satisfaction, evidence based practice, health technology, and health policy as the key aspects of the project and discuss about the growth experience personally and professionally throughout the RN to BSN program. The contribution of the intervention to patient satisfaction and quality of life. The intervention aimed to manage hypertension through periodic monitoring, tailored feedback, and lifestyle adjustments, significantly contributing to the patient's satisfaction and overall quality of life. As Jane reported positive change in her physical health and emotional well being, they met in that 3 hours meeting with Jane and her family. This consistent blood pressure monitoring, coupled with regular follow ups, gave Jane a better handle on how her hypertension day to day habits, diet, exercise, stress management affected her blood pressure. Jane said the family liked the structure the intervention gave her, particular how much it encouraged her to create a routine for her medication and other lifestyle changes. It helped them feel more confident in supporting Jane's health journey and assure they support her condition by providing clear guidelines. The use of evidence and peer review literature in the capstone project. Evidence-based practice principles inform the content and delivery of the intervention in the planning and organization of the capstone project on hypertension management. Only published per peer review article was consulted as part of the undertaking form. The Journal of Clinical Nursing and Hypertension. Information for this recommendation was obtained from these sources with regards to optimal recommendation related to lifestyle changes, management of hypertension, and education of the patient. Some published discoveries include frequent follow ups, patient participation, and family contribution towards the maintenance of chronic diseases. The planning process was also linked with proofs that supports the concept of patient specific and individual focused intervention to ensure the created intervention will fulfill the needs of patients. Applying the evidence-based patients in the project ensure that the project embrace the standard clinical practice and enhance positive patient result. Leveraging healthcare technology in the capstone project. Using the healthcare technology in the identified capstone project improve the patient status and interaction with the patient and her family. For instance, the use of digital technology in monitoring the blood pressure of the patient assisted the patient and everyone attending to the patient in evaluating the level of hypertension of the patient and changing the treatment plan accordingly. The technological advancements enable data to be gathered in less time compared to previous methods. It affords repeatedly more accurate reading than those obtained with the traditional method, and this in return aids in discussion about medication and changes in lifestyle. In addition, an online appointment booking system was implemented in order to make booking of follow up visits by Jane and her family to the care team. It made information flow and brought the idea that the patients were part of the decision making process of the management of Jane alignment as they were involved at every stage. There are many opportunities to improve healthcare technology used in future practices. It can be improved by using mobile health apps to track different aspects of the patient's health, including physical activity, diet, and stress level, side by side with blood pressure. The influence of health policy in the Capstone Project. The Capstone Project on managing hypertension was greatly influenced by health policies in planning and implementation. The content of intervention was based on the ACA, which emphasized primary and chronic care management in national and local healthcare strategies. The design incorporated those foundational principles as evidenced by patient-centered care, as well as the evidential-based practice highlighting in the patient policy. In regards to this, preventative care is watching high blood pressure and managing the alterable factors that may cause disease predisposing condition. The project also showed that coordination and frequent follow-ups as well as patient-centered care could yield better patient outcome and that such information should be useful in policy formation. In the implementation phase, this data could be adopted for future discourses on the case study of analyzing local practices in managing chronic diseases like hypertension and how they might change the local patient care policies. Capstone project outcome matching the initial prediction. The outcomes of the Capstone project on hypertension management matched or exceeded the initial prediction. After testing the intervention, regular blood pressure monitoring, lifestyle modification, and ongoing communication between the patients and the family, we found that the patient's health improved measurably. Beyond the expectation of increasing patient engagement, Jane's blood pressure was more stable and she had a greater awareness how lifestyle choices contribute to her diseases. As predicted, the success of the intervention was also a result of support provided by healthcare team and the family involvement. Personal and professional growth. I accomplished much personal and professional growth throughout my capstone project and the RM to BA10 program. Integrating evidence-based practice into my intervention has reinforced my ability to carry out professional patient-centered, ethical, and evidence-based care. I have I have grown in the ability to make decisions in such a way that the decisions I make sit in the middle of caring for patients according to professional standards and having a good amount of accountability. I am incredibly proud of the growth in my communication skills, especially when working with patients and their families to ensure they are engaged throughout the care process. In addition, I have developed more confidence in technologically applying the practice of healthcare and promoting its applications to reach improved outcome for patients. I have grown to understand better the complexity of managing chronic disease care and the role of compassion and empathy in care delivery. This program further my dedication to continuing to learn and become responsible for promoting good changes in healthcare practice and policies. In conclusion, the Capstone project on hypertension management showed that evidence-based practice healthcare technology and patient-centered care are significantly impact health outcome. Besides improving the quality of life and satisfaction of patients, family and healthcare provider working together have been emphasized. Key learning from applying health policies and technology were introduced to support best practice that could be employed in managing chronic disease. The most important lesson from this project was Baculei prepared nurses' critical role in advancing positive change within the healthcare system. The personal and professional growth I acquired on this project strongly reinforced my drive to improve patient care and practice healthcare. Thank you for watching my video, and this experience was a great one, and I'm happy to be part of this class, and this has been a great learning process for me, and I know I'm going to use this in my daily life or in the clinical to develop and build on my skills as an nurse and help my patients to achieve their goals. Thank you very much.